We're looking for disruptive and disturbed, right? Okay, the third group is just discuss the question, what opportunities are available for building a global health workforce that understands the role of culture and health literacy and perceptions and approaches to health disease, and Andrew will present.
Thank you. It's not often that someone says the truth. The destructive and disturbed person is coming out next. It's very nice. Let me just pause for a minute and say, you are also very impressive. It's just been a pleasure being able to interact with you over the last day and a half. So thank you for the opportunity. We had a great discussion. Why? Because there were people in the room, and like you all, that just contributed without sort of worry. The candor and openness of the discussion in general has been a true pleasure. So we had about a half an hour discussion where we were essentially saving the world. And then I had to impose the data collection process that you'll see. But there were a few little nuggets that I just want to share with you out of that first process. Just catchphrases. Past success is the greatest challenge to change, for example, a little word of wisdom. And then there's the phrase curriculum obesity, which I just find truly delightful, right? And then also in terms of recruiting students into health education across the board, the notion that we're fishing in a pool that's already ruined, I felt was pretty strong too. So in terms of what we did to answer this question, opportunities for building a global health workforce, first we need the metrics, right? How are you going to measure success? How are you going to measure process stability and sustainability? Another opportunity, of course, was smartphones and information technology. In general, the rapid proliferation of that new platform, which we just heard about. Interprofessional core competencies were seen as an opportunity, creating resource incentives to drive this change. So many of those were, of course, external to formal health professional education, opportunities in society and the economy as a whole. All starting from a common core, and then progress. An idea that's been well discussed here was just the power of that notion was seen as an opportunity by the group, and create demand somewhat like the ACA has done. But how are we going to do that given the sort of limited and restrained funding levels that currently exist? Other opportunities, scaling, always a challenge, but always a desire. Right? How can that be scaled to reach everyone, essentially? And then one of the ways to do that, of course, is to start early. Pre-K, not K through 12, start early and often engaging people in this notion that culture is rich and diverse, and health literacy can be a powerful tool for change. Another opportunity was seen in educating women. Why? Because we've seen that be successful so far. And within the pre-K through 12 discussion, there was a very explicit notion that that's a way to create family change as well, right? So it's not just the children, you're actually reaching the whole family. And then really looking at the important role of what we just quickly called the foundation workers, the front door of all these enterprises, be they health, social, political, economic, that we often undervalue, right? It earlier came up in this notion of professional versus non-professional. But there is a huge opportunity by incorporating those individuals around the world. Challenges to do this, of course, a lack and maldistribution of resources, corruption, and we had a couple examples come out of the recent Ebola case that really made that clear, but I think we're all aware that globally corruption is present and a challenge to many of our efforts because why? It limits the actual resources that we have to spend at the end of the day. Pedagogy, right? Bad, I'll just say it in the vernacular, pedagogy that exists that we need to remove, replace, fix, destroy, disrupt, et cetera, right? What we need is more dynamic and engaging learning. We need role models doing that. We need mentoring to support people in their effort. And of course, technology can really help that creativity. Of course, it can also be a hurdle if used inappropriately. More challenges. With all of this on the plate, there's a need to prioritize. What's going to go first? And what's the process to prioritize? And I would say even more importantly, who's involved in that prioritization process? to, in fact, change the existing paradigms so that what we've been talking about for the last day and a half becomes, in fact, the new paradigm. Entrenched interests are clearly a challenge to this process, and that's both within academia formally, but society as a whole, right? There's the supply of well-educated people, but then there's the demand, and they need to have a role. You could train the best health professional in all of these ways, but if they're working in a system that doesn't allow that new paradigm to take root, then you've got a real problem. And just the notion of outliers in education, research, professions can truly create a barrier to movement as well. So those were the challenges and the opportunities, and then we spent a little time essentially thinking about what would be the outcomes. And I was sitting here thinking this is a nice way to end it, because it actually paints a lovely rosy world of what it could be. Right? What could be if we could put even some of this into place, right? That we create a culture of service and caring. We use, this was a very strong theme across the group, I felt, experiential learning to achieve, and I love this phrase as well, cultural humility. Right? And that's very different than how a lot of people treat culture. Unfortunately, there's a history of this where people think culture is something outside and we're the 0 point, instead of being part of this rich blend of cultures that actually exists. That if we had a culturally aware global workforce, we would create empathy, we would create mindfulness, we would help people within the professions manage their own stress better as well, and they would take better care of themselves through care and nutrition, as would be true for societies overall. We actually would promote health if we had a culturally aware global health workforce. And I think it was really important, this in the parentheses to notion, right? Ecosystems, including everything, people, animals, the geography, the landscape, the terrain, the flow, the systems that make all those really intricate parts interact and create the world that allows us to be here, right? With an emphasis on health, wellness, and quality of life. And it would be a holistic approach, right? It would address the whole person, their worldview, and not only what they think about it, but what's actually there in their life every day, the impediments, barriers, and things that help live a healthy and happy life. Now, if we had a health literate global workforce, we split it off, a culturally sensitive and aware versus a health literate, that in fact, we would be able to communicate successfully, right? In whatever mode it happened to be in that community, whether it's written or spoken, through numbers, through symbols, through movement of body and awareness of the space that we move in and share, that we actually would have a shared understanding of disease, health, and well-being with individuals and communities, so that when we use these words and these concepts, we have some certainty that we have a shared understanding, whereas right now in many instances we just don't. We have a lot of shared words, but we don't have as much of a shared understanding as we really should. That people, broadly speaking, would understand science and the importance of evidence, and also how evidence is valid or invalid, the process of science, what counts, how when you get on the internet and search for diabetes, that you really don't want to look at all of those websites. How to do that is a real skill. That there would be a community perspective that would change the notion of what's acceptable in terms of health and disease interventions, both within the workforce and society at large. And then that workforce, if it were truly health literate, would actively engage patients to create not only a healthier world, but also more advocacy across society to create a healthier world. And I always throw in happier too, because I think it's equally important as an outcome myself. And we would have a measurable process with distinct outcomes. Personally, my bias, I was very pleased that the group seemed to coalesce around the notion that health literacy is a process, it's a way of interacting with individuals, communities, families, and populations. It's not a collection of knowledge. It's also not a static set of skills and abilities, because the world changes, those skills and abilities have to adapt as well. And that process would, again, have distinct measurable outcomes. Objective health status clearly being one of them, but also process indicators and quality improvement indicators. And we just really wanted to underpin this with the importance of fundamental literacies tied to economic development. this is the way the world has gone. It's just true. So that fundamental skill underpins all of this and shouldn't be neglected just because we have a concept of health literacy as well. And that's how people will tie themselves to addressing the social determinants of health. It takes those skills, in particular that skill. And that was our conversation as we noted it. It was a fabulous group, tables 1, 2, and 3, and people who just came in because some of you didn't really follow the directions, which I think is fine. But other comments, thoughts from those of you who were there? Okay, thank you all.